Welcome back, veterans. Dave Eling with the County Department of Veterans Affairs and another segment of Veterans Did You Know? We're at Busy Nurses, and don't adjust your camera here or your TV set because the person who's sitting here, Denise, is here now. And Denise is the Executive Director, Garmin, of everything that takes place here. The head honcho, the big cheese, the big kahuna, all the hats, like me, and Beth Static, this is her here. So it's my counterpart here. Just
build me up too much.
There you go. You got no place to go. But so Denise, we heard a lot of information on what hospice is. It's not the Grim Reaper. It's the roses, the soft landing, the care, the hand at the end of life. And I still think people sometimes worry about our misconception. Hospice costs you. It's going to cost you money, you know, for this group of highly trained specialists, number one. But to come into my house, at my home, there's no way we're going to be able to afford this. That'd be I don't think we're going to call them or even consider that, but that's not the case.
It is not the case at all. We work with most of the insurance companies, Medicare, Veterans, Medicaid, a lot of the third-party payers, Priority Health, commercial insurers, that sort of thing, most of which have a hospice benefit that you are entitled to. And we use that word specifically because it's something that you've earned and you've worked for your entire life. It covers not only the cost of the care, the staff that come into the home, but anything that's related to that diagnosis, that terminal diagnosis. If you have lung cancer and you need oxygen, that's something that the hospice program is responsible for. So really, there isn't a whole lot of expense. It actually saves you money to be on hospice because you don't have to pay for
hospital room,
the hospital bed, the any other assisted devices you might need, the oxygen, and so forth.
So while I'm going through hospice care, I don't have to have my checkbook out writing a check for everybody.
Not unless you want to make a donation.
There's the part I really want to get to. So this is all free. I mean, this is no cost to you. It's billed.
Absolutely right.
They bill everybody and their brother that's out there, and you're the last person who doesn't get billed anything because the care is free. That's what it's all about. However, there is additional cost that you may not have insurances, or Medicaid only covers so much, or Medicare, or the VA, or whatever. And then it comes down to you guys just putting out because that's what you got to do. That's what your job is. So if somebody wants to pay it forward, or wants to just say, you know what, I had a family member who went through hospice and it was an excellent experience. How do I give back? How can I make sure that this service is available for other people who want it, to have it available to? So you're a nonprofit corporation.
We are.
And you can accept donations.
We do.
Cool.
Yeah, and let me give you a perfect example of the way we've used donor funds in the past. Not too very long ago, we had a patient, and I don't remember exactly what his diagnosis was, but when our therapist went out there, and therapy isn't generally something that is part of the hospice services or continuum of services, but this particular patient was literally laying on a couch in a ball. I think there was some kind of tumor. I can't remember exactly what it was. And our rehab leader went to make the home visit to do an assessment because the nurse really thought this patient could benefit from a therapy visit and some recommendations. And many years ago, this leader had worked with patients in a facility and used a specific walker. And she thought that if we got this gentleman this walker, he'd be able to walk. He had lymphedema, which is severe swelling in his arms, so he couldn't use a regular walker, and this had elevated arms. Well, the piece of equipment was $750, and it was something that would really improve his quality of life, and it was a decision that we made to spend that money on this patient. We now have this equipment for other patients.
But the individual cost up front was, the uniqueness of this. It's not like you use this on every single patient. This was something pretty big cost.
And the beautiful thing was his wife looked at this therapist, and she actually sent a very beautiful note to us thanking us. Thanking us so much because she got her husband back.
Yep. Able to be mobile, something like that. So.
Yes.
Cool.
Yes.
So okay, that can do that. Now, fill me in some more on what your part is in dealing with them, the patients.
With the patients, I generally don't deal with the patients. The managers and the clinicians actually work with the patients. My role is to really make sure the place stays vibrant, the doors stay open, patients keep wanting our services, making sure that our customer satisfaction is top-notch, our quality care is state-of-the-art, top-notch care, just really overseeing that those things are in place.
But as I said, I think people at first are a little afraid. You know, we use the Grim Reaper as just serendipitously that's what the hospice, because it's kind of a scary word, hospice. Dead, done, we're finished, it's over with, you know. But it's not that, it's the direct opposite of that. And so now we find out, look, here's a pretty cool place to be. You know, if you got to go, this is a place to go. And the place would very well be your home and your own setting. And I don't think anybody really realizes that you think you have to go to an institution or you have to go to a facility. You start thinking, I can stay right here in my own house. I mean, this is where I can stay, and it's okay right here.
Yes.
Yeah. So you bring a hospital bed in if you can't sleep in a regular bed, and the people come to you. I think that's. I don't think half the people, maybe more out there, didn't understand. I hope you're getting the hint from this is how wonderful hospice is, and what a service this is. What a service this is, and being able to make this happen. And we talked about volunteers. So if you want to volunteer, you have to listen. You got some time on your hands. You want to give back. You want to be around some phenomenal people. How do I do this? Would I just call that number and you're going to hook me up?
That's correct. 231-672-4663. And the one thing we talked about when we were not on camera is what about the family, and you know, that spouse that is going to be left behind, and in what kind of condition. We are required by Medicare to provide bereavement services 13 months post the patient's passing. And we've taken that and put it on steroids actually by creating this healing center and really having some very robust bereavement programs for people who have lost spouses, children who've lost parents or loved ones. So we are there to really support that family. I love to cut my hands like that, because that's what we do, is like literally scoop that family up and take them under our care to guide them through the journey of their loved ones passing.
How extended of a family would this cover? Your brothers and sisters or
whoever wants to be contacted. Whoever wants to be contacted.
And who's got a loss. I don't care who you are. If you lost that person, you loved them, then there's that whole process go through, and how you handle it or don't handle it makes it get better, maybe faster, or be able to cope with it easier.
Right.
And it's kind of like we said, if you're in the medical field, you're around things, so we see this, we see the difference. But trying to convey that to a lay person, I said, believe me, this is so much better. This is so much easier. This is where you really want to do this. And it's a PTSD thing, because when you lose somebody, it's a very stressful time in your life.
Sure.
And those are mental conditions that you've got to address. You've got to address. You can say, I'm tough, I'm strong, I'll hold it in, I'll go cry in the corner by myself, and 3 days from now nobody's saw me and nobody's going to see me shed a tear. Shame on you. What an idiot. What are you thinking? Why are you going to put yourself through all that torment and all that sadness? You have to bereave. You have to do it, but you be around people to say, this makes it easier. Makes it easier. And I've seen so many vets who finally get into counseling with PTSD, and they finally realize, geez, I'm not the only one who feels like this.
That's right.
I'm not alone anymore. Other people like this. And you take those layers back, you unpeel them. And death is something nobody wants to really talk about. It's not the best time of your life, probably, but it is a time of your life, just like you're born. You weren't crazy about being born and pushed out of there, and it's cold and somebody's grabbing you, smacking the heck out of you, whatever else. You weren't really crazy about that. At the other end, it's not so joyful either, but it can be relaxed, it can be monitored, it can be controlled to a degree, and it can be made as gentle as possibly by just reaching out and making a telephone call. So if you're out there and you happen to have a terminal illness, or somebody in your family that does, they've got that diagnosis, and you're always wondering, how are we going to do this? Don't do it on your own. Don't try to even do this on your own. There's a phenomenal group of folks right here that'll come to your house from the very onset and talk about a game plan. A game plan. Here's what you're going to do. Here's what's going to happen. Here's how we can help you. Here's what you'll see. Here's what we can figure out. And nobody knows when that last second's going to be. But, you can take advantage of all those seconds that you have.
Absolutely.
Make them productive. Don't waste them. Don't waste those. Do something constructive with them. And you folks, again, I've said this before, kudos to anybody in the healthcare profession that works with children, neonatal. or works with hospice, end-of-life issues, that's the toughest job. That's tough because you're seeing somebody to be taken way too small as a child, and somebody who's given all their life, and you want them to go out gently. You don't want to be a harsh exit from this where we are here in this world. So.
And as Moni mentioned earlier in the previous segment, our whole life we go to cardiologists, we go to oncologists, we go to all these specialists. Hospice is a specialist, and I think that's one of the most important things I want people to take away from this.
We talked about off camera. We talked about a lot of stuff off camera. It's kind of like you get these great ideas. We say, write that down quick. Somebody write that down. That was then we lost it. Then we come back, we get it again. But the bottom line to remember, and through the whole thing, is there's help out there. There's very qualified help. You can't beat the price. You can never find more compassionate people. Pick up the phone, make a call, or put this on your Rolodex someplace or on your refrigerator. Should the time come, call this number up here, and it'll be a much gentler journey for you than it might otherwise be.
Don't do this alone.
Yeah, don't do this. You don't have to do this alone. There's no sense in doing it, and I don't care how tough you think you are. Alone is alone. It's always nice to have somebody there with you. So, all right. Thanks very much, Denise, for having me out here.
Thank you, Dave. It's been a pleasure.
This has been a good segment. I hope everybody goes back, and make sure you go back to the very first one and watch the whole thing, because there's some tremendous information in there and stuff you need to know. So thanks again for tuning in, and we'll see you next time around. Have a great day.